Okay, hi everyone. Thank you for joining us today. First, I'll introduce myself. I'm Rachel, and I'm an independent living advocate at the Center for Independent Living.
Hello, everyone. Welcome. And I'm Shanti. I'm also an independent living advocate. So I hope you enjoy our event. It's going to be really exciting. To start, I'd like to tell you a little bit about what this event is about. It's going to talk about a research program which is called All of Us. And All of Us honors the nothing about us without us sentiment because it invites people with disabilities to contribute to precision medicine research. Precision medicine is relevant to people with disabilities because it specializes in health care and it is more tailored and more effective to an individual instead of a one-size-fits-all average. So we have a guest speaker today who's going to be talking about the research. His name is Carl Cooper, and Rachel would be introducing him to us.
Hi, everyone.
Rachel.
Okay, so Carl is an attorney and fellow advocate who has spent most of his career addressing the needs of people with disabilities. Currently, he serves as a director of public health programs at the American Association on Health and Disability, where he oversees a number of projects that engage the disability community in public health initiatives. He provides technical assistance to navigators and other enrollment specialists as they help people. Among his many achievements, he advocated for and monitored reauthorization efforts for the Workforce Investment Act. And again, thank you, Carl, for doing this presentation. We really appreciate it. And it's your go.
Okay, thank you very much for having me. It's a privilege to be here. As Rachel said, my name is Carl Cooper. I'm the Director of Public Health Programs at the American Association on Health and Disability. And today we're going to be talking about the All of Us research program and giving you an introduction and telling you why All of Us includes people with disabilities. But first of all, before we get into anything, I know that we talked that I'm from the American Association on Health and Disability, but many of you may not be familiar with our organization. So I wanted to sort of give you a little bit of background on who we are and what we do. The American Association on Health and Disability, or AAHD's mission statement, is to ensure health equity for children and adults with disabilities through policy, research, education, and dissemination. We are a cross-disability organization, so we work on disabilities regardless of type, whether they're physical, intellectual, developmental, sensory, or even mental health. We work on all and advocate for all types of disabilities. We're also across the lifespan, so some organizations maybe just focus on children who have disabilities or older adults who have disabilities, but we look at things from the full lifespans of children all the way up through and including older adults. We do our work through advocating for 5 main things. We work to reduce health disparities for people with disabilities. We advocate for community inclusion. We work to promote full accessibility, especially in healthcare settings. We work to integrate disability into the public health agenda. And we also work to advance knowledge translation and disability research. So this is how we do our work. We are located in Rockville, Maryland, which is just outside Washington, D.C. As a national organization, but we have people who are staff members who are located that work remotely and are located all across the country. And we also work with a lot of different organizations who are also located. And I'll be talking in a moment about some of the work we're doing on the All of Us program and how we have done that through local organizations like the CIL in South Florida. Well, let's talk a little bit about the All of Us research program and specifically what it is. And the bottom line is the All of Us research program is a program that is seeking your uniqueness. They are endeavoring to enroll 1 million or more people who will be involved in this research study for a 10-year period and maybe beyond, and working towards precision medicine. And I'll talk in a moment about what we mean by when we use that term precision medicine. But their motto is the future of health begins with you. And this particular slide shows images of several people of varying races, ethnic backgrounds, and ages, and really reflects what they're trying to do with this particular research program, which is include a vast array of individuals, both racial and ethnic, and also abilities as well. So a little bit more about the All of Us Research Program. The All of Us Research Program is aiming to gather data from 1 million or more people to accelerate research to improve health and so we can have individualized prevention, treatment, and care for all of us. This slide includes a photo of Dr. Francis Collins. Dr. Francis Collins is now the former director of NIH. He retired at the end of last year, so just a couple months ago. But when this program started, he was quoted as saying, "All of us is amongst the most ambitious research efforts that our nation has undertaken." And it was part of the 21st Century Cures Act, which was passed in December of 2016, and was one of the final things done as part of the Obama administration. But one of the great things about this is it was a program and a law that was passed that really had bipartisan support, which is a rare thing in Washington these days. So everyone that's involved with this program especially is really proud of the fact that this is something that it goes beyond politics. It's really about just trying to make sure that we're doing the best for everyone in our country, and that we are trying to do what we can to improve the health for everyone so that we don't have to continue on with this one-size-fits-all approach to medicine. So you've heard me mention precision medicine and what we're doing with precision medicine. And so let's define what we mean by when we talk about precision medicine. So what is precision medicine? Precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in both lifestyle, socioeconomics, environment, and biology. This particular slide shows 3 circles that are all connected that represent those 3 areas: lifestyle, biology, and environment, and really shows that it's important that we're making sure that we're taking all of those into consideration. This is a radical shift in how each of us can receive the best care possible based on our unique makeup. And it's really transformational for NIH. NIH is really doing something that is beyond what they normally do. NIH is typically takes their cues and operates in a way that we talk about as being within the medical model. And when you talk about the medical model for disability, that usually means viewing disability as some sort of a disease or something to be cured or something like that. We as the disability community know that that is not true, that the disability community is beyond that, that the disability community can live healthy lifestyles with our disabilities. It's about making sure that we are looking at things more from the social construct of disability, which looks at barriers in various areas. And in this particular instance, barriers to health. What are the barriers that we encounter? It's not about our disability, it could be about the barrier. I'm a wheelchair user and I can get around fine if I'm in an area that is fully accessible, that has ramps and has curb cuts and all those kind of things that I can get around in my wheelchair, so that there are no issues and there are no barriers to me being able to access various services that are available. So that's what we talk about when we talk about the social construct, is that disability only exists when there are barriers that sort of come up and really become a problem for individuals as they encounter them. So NIH really is looking at things like lifestyle and environment, and this does then talk about barriers and all those kind of things. So we are excited that this really is looking at issues that we in the disability community have been talking about for years. And NIH is really taking a transformational approach and looking beyond just the biology of what's going on with our disability, but let's look at some of the other factors that come into play as well. So what are some examples of precision medicine? Well, we have precision medicine already in some degrees. For those of you who can see, you can see I'm wearing eyeglasses today, and these eyeglasses are specifically made for me. They're not going to work for you. They're not going to work from anyone else that has sight problems, and it would only work for me. So prescription eyeglasses are a perfect example of precision medicine where they are unique to the individual. Insulin pumps and hearing aids are other examples of this, where they are specific instances where something is calibrated to the individual. So the individual then we can have them recognize, when they use these types of devices, that they are specific to that person. They're not going to work for someone else, even if they have that same condition. So those things are calibrated for that person's individual needs. Blood transfusions is another example where we have different blood types and making sure that the proper blood is being used for each individual. So these are examples of precise medicine. But let's talk a moment about imprecise medicine. What's the cost of imprecise medicine, which is what we have in many instances today? Well, the problem with imprecise medicine in this particular slide shows columns that really deal with the patients, the providers, and researchers. For the purposes of today, I'm going to be focusing most of my attention on the patients column here. And the patients column, it shows that there are some big costs for imprecise medicine. The cost is that healthcare is often targeted to the average patient and not the specific individual. And we often see this, for instance, if you are diagnosed with high blood pressure. And your doctor tells you you've been diagnosed with high blood pressure, we need you to do something to bring this under control. So what do? They work with the individual and maybe prescribe a medicine. And they say, okay, here's a statin medication that we give to people to try and help with their high blood pressure. So they provide it to the individual and they say, okay, here's what you can take. And you can take this and it will allow you to hopefully bring your blood pressure down and bring it under control. Well, the person starts taking the medication and they try it out. Sometimes it works for the individual, but sometimes it doesn't. Sometimes, and then you have to go back to the doctor, and the doctor says, well, let's try and increase the dosage. Or they may say, let's try a different medication altogether. Well, in the meantime, we have this trial and error method that's happening as a result. And trial and error is got some major problems with it. The first major problem is the person is not getting the benefit of the medication that they're taking. They still have the high blood pressure. It's not doing what it's supposed to do. And the other problem with it is that it's giving them potential side effects that are affecting their health in other ways when they're not even getting the benefit of the medication to begin with. And we see this quite a bit that happens with individuals. And we want to understand why that is. Why does it work for some people and not for others? And wouldn't it be nice to be able to go to a doctor, and if you get diagnosed with something like high blood pressure, they could look at your whole medical picture and say, okay, this is the medicine that should work for you and at this dosage. And if they could figure all that out, like they do at an eye exam when you go to the eye doctor and they do the tests with the machine and all that kind of stuff, and they can tell you what your prescription is and give you a very precise eye prescription, wouldn't it be nice if they could do the same thing for things like high blood pressure? So that's really what we're talking about. The cost of the imprecise medicine is everything that the person has to go through as a result of trying to figure out what the best way is to treat them when we don't know those questions right off the bat. So that's sort of the cost of imprecise medicine to us as individual patients. This slide also talks about, what it means for providers and researchers as well. Imprecise medicine for providers means that they're sort of also shooting in the dark. They don't exactly know how to treat the patient in the best way. They have some basic ideas of some of the best things that they could try, but ultimately there's no guarantees that any of that stuff is going to work. And lots of times those providers don't have the ability to look at patients one at a time to sort of really dive into their health history. So if we had some basic information about the individual that could really help inform their decision-making, it would be a lot better as well. So these are some of the costs that we have in the current way we do healthcare, which is imprecise, and we're trying to improve that with this particular research study. So what's being asked of participants in the All of Us research program? Well, there are multiple things and multiple steps to get involved as a participant of the program. And this slide shows various ways that you can get involved. The first column talks about enrollment and consenting and authorizing the use of electronic health records. This is the first thing you would do if you were wanting to get involved in the program. You would go through the enrollment process, you would set up an account, and then it would take you through a consent process. All biomedical research requires people now to go through consent processes so that individuals, we can make sure that those folks are, that they understand what's going on and they understand what kind of a thing that they're getting themselves involved to. That's what the consent process does. So you go through the consent process, and then it also asks you if you want to authorize the use of your own personal electronic health records in the study. If you decide you want to do that, you can. If you want to opt out of that, you can do that as well. It's based on whatever you feel comfortable doing. Once you do that, then there are various stages you can go to and get involved with to become fully involved in the program. The next thing you can do is the second column, which is you can start answering surveys. And I'll talk in a moment about what surveys exist. This slide shows some of those that already do, but I'll talk about them a little bit more on the next slide. Then the third column shows that they also look at taking physical measurements. Physical measurements are issues like blood pressure, body mass index, heart rate, height, hip circumference, waist circumference, and weight. So they do all these on site, and I'll be talking a little bit later about where all that is done. But at the what you need to know for purposes of the presentation right now is that these are all done, and they record all of that, and that can help inform researchers as they're looking at the data later on. You can also then, the fourth column talks about providing biosamples, and there are multiple ways you can do this. You can go to a place like where they do the physical measurements, and you can provide a biosample either in form of blood or urine or both. Or if you want to do it at home, they can send you an at-home kit where they can use saliva to do a DNA sample. All of that information is stored in a biosample in the program's biobank, and I'll talk a little bit later about the biobank and what that means a little later on. And then the fifth column that we see here talks about using wearable or digital apps. And this is still in the pilot phase, but they are working with trying to have people work with wearing Fitbits and having that data get reported as part of the program. So that's all stuff that gets used that can help inform researchers as well. So that's still in the pilot phase, but that's something that they may do down the road. So I talked a moment ago about doing the surveys. So what surveys are we talking about? There's multiple surveys that exist now. They have 6 core surveys that they do. These include information on your basics, on your overall health, on your lifestyle, on your personal health history, on your family health history, and on your healthcare access and utilization. In other words, how often do you go to a provider and utilize the healthcare system? So those are the basic core surveys that you have when you would join the program, and you can go through those. There's other surveys that the program has put out. I've just got a couple listed here. One of those is the COPE survey that they were doing through the COVID-19 pandemic. COPE stands for COVID-19 Participant Experience, where they were really asking a lot of mental health questions. So once again, this goes beyond just the biological questions that normally happen in biomedical research studies. They really do care about all phases of health, including mental health, and that was part of the COPE survey that they did. They also have a new one that they put out this year called the Social Determinants of Health survey, and that's a recent one that they do that really looks at some of the other factors that play into our health, like our environment, like our housing situation, like our access to transportation and other social supports and services. So that's all included in the Social Determinants of Health survey. And we as people with disabilities know that social determinants of health do play a large role in what happens with us and how it affects our health. So those are some of the surveys that you can do. Do want to talk about some of the values that the All of Us Research Program really believes in. Some of these I'll talk about in a lot of detail now. Some of them I'll save for a little bit later. But one of the things that I really want to point out with now is that participation in the All of Us Research Program is open to all interested individuals, and they want it to reflect the rich diversity of America. What the program really is trying to get at is they really want to make sure that there's a lot of groups that have historically been left out of biomedical research studies, and they want to make sure that those groups feel welcome and included in this kind of a study. And they want to do that by earning trust. So they want to do that by having partners be participants in the program. They want to be able to do it through engagement and full transparency. And they want the participants to have access to the information and data about themselves. This isn't going to be something you're just going to be involved with, and then the data is going to go out there, the researchers are going to see it, and you're never going to hear from it again. They want this to truly be interactive, where you can learn about yourself and understand more about your health. So if you do the DNA, for instance, they have a whole system where they return your DNA results to you, and they tell you about it, similar to like a DNA service that you've heard about maybe in for-profit companies. And the data from the program will be broadly accessible to empower research. And I'll talk a little bit in a moment about some more of this stuff in terms of how they want to make sure that a lot of researchers have availability to this document. And they also want to make sure that they are protecting participants' data. And I'll talk a lot more in detail about that as well. They want the program to be a catalyst for innovative research programs and policies, and they really want it to be a partnership with researchers and participants as well. But as you can see in these all of us value statements, one of the things that jumps out to us as a disability organization is this idea that they are actively recruiting and inviting people that have historically been left out of stuff like this. And we as a disability community know all too well that disability many times gets forgotten about in programs like this, and they get excluded from programs like this. And we want to make sure that that's not the case anymore. So as a result of that, we really think that this reflects the all of us motto of nothing about us without us. And here's a program that wants us to be involved. They really want us, and they want us to make sure that our data is getting used. So as a result, it's important for us as a disability community, when those requests are being made and people are actively looking for us to be involved, that we're answering that call and we are going to be part of this program. As I've already talked about a little bit before, this really is a transformational approach to diversity. They really want there to be a diverse membership of participants in this program. And that means a bunch of different areas. So we're talking about a diverse type of people. That's racial and ethnic, the makeup of racial and ethnic groups that are many times left out. And sometimes it's because those racial and ethnic groups don't trust programs like this, and they want to do everything they can to break down those barriers, to let them know that past discrepancies and past atrocities that were done in health research, like the Tuskegee experiments and those kind of things, are no longer done, and that we are really looking at trying to make sure that people are respected and their individual preferences are protected, and that ultimately we are doing everything we can to include everyone and their people groups. This also includes not just racial and ethnic minorities, but also sexual and gender minorities, and also people of various disabilities. So all of these people, they want to make sure are included. And this particular slide shows various images of all different types of people, different abilities, different ages, different races, and it really does show the rich diversity that exists in our country, and we want to make sure that that is part of what we're doing in terms of the research. They also wanted to reflect the diversity of the country as it relates to geography. Things are a lot different in South Florida than they are in other parts of the country, and we want to make sure that those areas get represented, that we are having, urban areas represented, that we're having rural areas represented, and that we make sure that everyone's data is included. We also want to make sure that health status is taken into account, people with prior existing conditions, people with disabilities, and people who have lived healthy lifestyles their entire lives and maybe have not had a disability or not had major health problems throughout their life. So they want to make sure that they include all folks in this particular study, and they want to make sure that the data types are diverse as well. So this really is a transformational approach to participation. I've talked about this before, but they really want participants in the All of Us research program to be true partners. They don't want them to be viewed as patients or subjects. They really want them to be involved. They want them to be involved in determining what data is collected, in what the lab analysis does with it, what research is conducted, and how the data gets to return to the individuals. And they really want people to be part of that process, and that participants feel like they are part of that process. But I talked a little bit about the data and the researchers, and we want to make sure that the participants specifically understand that they want this to be available to folks that are beyond just maybe big, corporations and industry or big research universities. They also want it to be available to smaller schools. They want it to be available to community colleges and high schools. They want it to be available to citizen scientists, so that if an individual wants to research something, they'll be able to access this data. Now, with that understood, they also want to make sure that they're doing this in a responsible way. So data sharing will be a priority to both researchers and participants are going to have access to study information about themselves. But they also want to be smart and have it grow over time. And they also want to make sure that it continues to protect the privacy and security. They don't want people to be able to go in there and do research and find information about a specific individual, so that you don't have to worry that your specific data is going to be mined from someone to be able to locate you and figure out what's going on with you. High standards that researchers are going to have to abide by to make sure the data workbench. So they are investing in trying to level the playing field so diverse researchers can participate in this, but they really want to make sure that they're also balancing that with protecting the data for their individual research participants. So what's the promise for participants? Well, this is really an opportunity to fight disease and improve the health of future generations. But it's also a chance to learn about your own health, including your own personalized risk factors or your exposures. It's also an opportunity to ensure that your community is included. And that includes your specific conditions. If you have a disability and you want to make sure that people with your disability are able to benefit from the advancements that are made as part of this research study, then it's important that we have people like you representing your disability type in the research cohort. There's also the chance to meet other individuals who could that are like you, that could perhaps and even join them in doing research of your own on conditions that you experience. They really view this as a long-term relationship, and they want the value of this to really grow between participants and researchers and have it be a collaborative effort. If you are interested in researchers and what the researchers are doing, I'll spend just a little bit of time on talking about what is the promise for researchers. The research hub can be found at the website located on this slide, which is www.researchallofus.org. And it's an opportunity to save time and resources to accelerate research breakthroughs. The researchers are given the opportunity to work together and share workspaces and do analysis together with other researchers as well. So really, they want participants and researchers to be able to work together, and they hope that this research hub will allow that. Now, obviously, one of the biggest questions I get, and one of the biggest barriers, I would say, that people have to wanting to get involved in something like this is, how do I know my information is going to be safe? It seems like every week we hear on the news about a data breach that happened at some location. Maybe it's at a bank or a store where credit card numbers got out or something like that. How do we know that if we provide this data to the research program that it's going to be protected? The program has a plan in place to make sure everything is protected. So they do have an approach to privacy and security that's guided by privacy, trust, and data security principles that's developed by experts with input from the public. They want to know from experts. They're constantly asking experts what they can do. The data warehouse is built with the most advanced security available, and they've had experts who do and continue to do rigorous testing. And as improvements are made, they constantly are upgrading what they're doing with the data and where it's stored to make sure that it is protected. But the other thing that they do is they make sure that the data is encrypted and direct identifiers are removed. So for instance, if you go and you give a biosample at a location and they take they put your information in a test tube. That test tube's not going to have your name on the side of it. It's going to have a code that you're going to have be able to access something else to be able to tell them exactly who that belongs to. So really, it's stored in separate areas. So someone would have to breach multiple locations to be able to put it all together. And they do that as a way to make it more difficult to try and access this data and be able to put those pieces together. And if any one of those were to have a breach, they would be able to do things to protect the data in the other locations. So they want to make sure that all of those things are done to protect individuals' data. As I said earlier, researchers have to agree to a code of conduct before they're allowed to access the data. They're not allowed to go in there with the purposes of trying to locate specific individuals and find out about specific individuals' health. Participants' preferences are respected. So I mentioned earlier, you can get as involved as you want. If you decide you want them to have access to your electronic health records, you can do that, and that can be part of the data set. But if you decide you're not comfortable doing that, you can say, I'm going to opt out of that, and I'm just going to do the surveys. I'm fine with just doing the surveys. And if that's all you want to do, that's perfectly fine with the program. It's also protected by a certificate of confidentiality, which is very important to the disability community because many times sometimes the question we'll get is, well, if I'm going through a disability determination with Social Security, are they going to be able to access all my records that are given to the program? And the answer is no. They might be able to access medical records through other ways, but they won't be able to access it through the NIH All of Us research program. So just because NIH and Social Security are both part of the government, this one is not allowed to give it to the other. And in fact, even if you are looking at a disability proceeding that's outside of Social Security, if you're trying to make a claim with a disability insurance or something like that, they cannot subpoena the program for your data to find out more about you. And they do that because research programs are given certificates of confidentiality that they are allowed to, if someone were to subpoena it, the certificate of confidentiality allows a judge to say, no, you can't have access to that. And ultimately, the data is secure so that as you participate as a research participant, you can fully participate, answer questions honestly, and not feel like that could potentially come back and be used against you later on. And they're committed to transparency in the event of a data breach. They're doing everything, all the things that I mentioned also on this slide to protect your data, but they recognize that they can't 100% guarantee that a breach will not occur. They're doing everything they can to avoid it, and they think it's very unlikely that a breach would occur. But if a breach were to occur, they will be transparent and they will be forthright with participants to let them know it has occurred and what they need to do to protect themselves in the event that the breach were to occur. So I do want to talk briefly about what we as the American Association on Health and Disability are doing about doing outreach to the disability community about the All of Us Research Program. The All of Us Research Program launched in May of 2018, so it's almost been going for 4 years now. And we've seen a lot of growth in the program, but we still have a ways to go to get the 1 million or more people enrolled. And this is a long-term project that NIH is recognizing that they're going to have to do if they want to get the amount of involvement that they really want, especially from underrepresented biomedical research groups like people with disabilities. So they are doing a lot to do this outreach. And we as AAHD are part of the community and provider partner network that they have. We are what's referred to as a community engagement partner. We work with other national organizations that are trying to reach organizations that, trying to reach individuals that have that are typically considered part of the underrepresented biomedical research groups. So you'll see at the very bottom of this slide, there's a bunch of specific organizations that are referenced here that do a lot of outreach to various racial and ethnic groups, such as the Asian Health Coalition, the National Alliance for Hispanic Health, the Delta Research and Educational Foundation. Those all do outreach to specific ethnic and racial and ethnic minorities. PrideNet does outreach to sexual and gender minorities. And there's other groups that also do outreach to other groups, like 54 does it to older adults, and AAHD, our logo on here, which does outreach to people with disabilities. So we're part of this larger network that's doing outreach to a lot of different organizations. So what is AAHD's specific role in this? Well, we are identifying and funded trusted intermediaries. We're trying to do that through finding local organizations and also national organizations to help us do this outreach. That's one of the reasons why we are working with the Center for Independent Living in South Florida. We are also working on developing a disability-focused rationale for involvement in the All of Us program. We're constantly updating messaging to reflect that. We review All of Us program materials and messages to ensure appropriateness for people with disabilities. So really trying to make sure that we are doing what we can so that those folks have, the message is going to resonate with them. And as those of us who have disabilities recognize and understand, if we don't see ourselves in the imaging, we're probably not going to be as inclined to get involved. We also conduct national education and outreach on the All of Us program to the disability community. So this particular slide shows when I was exhibiting at one of the disability conferences. I believe this was at the conference for April, which is the Association of Programs for Rural Independent Living. When they had a conference, this was pre-pandemic, so this was a few years ago. When we were exhibiting at their conference, this was when I was at the exhibit booth that we had there. But like I said, we're working on developing All of Us materials. And one of the things that we do is we try to make sure that they understand that we need to include people with disabilities in messaging, and that includes diversity of people with disabilities. And so often, whenever you tell someone that you need to include images of people with disabilities in imaging, you get something like what you see on the right side of this slide, which is a white person in a wheelchair. And one of the things that we're trying to do and make the program aware of, and other folks that do outreach in this community, is that there's disability in all groups, and that there is disability in other racial and ethnic groups. So we need to make sure that our imaging is also reflecting images like the one to the left, where we show an African-American individual in a wheelchair. But that also includes diversity of disabilities. Some disabilities are invisible. Some disabilities are harder to show in an image. But we can do things like showing a person with a hearing aid, or showing people using sign language to communicate, or showing someone using a guide cane to walk. All of these things are ways that we can show diversity of disability as well. And it's also important that we include that with testimonials. So I have a quick testimonial here I'm going to play for you from an individual named Manuel, who has a disability, and he's going to talk about why he wanted to get involved in the All of Us research program.
I've always had a positive, upbeat attitude, because there's just too many good things in this world. You know, the world is what you make it up here. I have 2 prosthetics on due to diabetes, of course. Different people have different diseases, different problems. What caused this might not be what causes somebody else's diabetes. Yes, I think it's important for all people to be represented in medical research, all these different age groups, ethnic groups, regions of the country. You know, they get together, tell their medical histories, so that we can all get the full benefit of what medical research has to offer us.
So that's just gives you an idea of some of the things that we're trying to develop and help develop more of, so that we can really show the disability voice on this particular program. I mentioned earlier that we're doing outreach all across the country with various groups in terms of doing outreach. And this shows some of our local partners that we've dealt with and worked with and funded over the years that we've been doing this project. The states that are in dark blue are where we are currently funding partners. The states in light blue are where we have done work. The program does shift in terms of markets. So sometimes, for instance, they added Miami recently, which is why we're working with the Center for Independent Living of South Florida right now. Then there's also other groups on here. You can see that we utilize a lot of centers for independent living across the country to do this. Of the 6 that are listed on this particular slide, 5 of them are centers for independent living, but we have groups in Denver, Colorado, Boston, Massachusetts, Miami, Florida, Atlanta, Georgia, Houston, Texas, and Chicago, Illinois. In terms of Houston, they're the only one that's not a center for independent living, but they are a TA center for independent living centers and have a unique understanding of the independent living movement and really have tried to do what they can to do the outreach like basically a center for independent living would. The other thing that I'll point out in terms of the light blue states, of those, some of those are also organizations that have a more of a national reach, and we've started doing work with national partners this year. So for instance, our former local partners in Montana, New Mexico, and Alabama are all part of our national network now as well. So they're helping us do work in those locations, but also on a national level as well. And then we've also worked with the Center for Independent Living in New York City, which they ultimately decided that they were no longer able to continue because of all the work they were doing around COVID-19. It became a staffing issue for them, so we moved on to other markets that the program was focused on. So I mentioned earlier, I put this slide up here, and this is a very, very busy slide, and I'm not going to try and go through and explain this whole thing to you. The reason I'm showing this to you is to show that they have a vast network of consortium members, which really go beyond the community partner members I was mentioning earlier. And this really shows the various groups that they have that help with a lot of the different phases of the program, like the biospecimen collection. So for instance, the middle row here is what we refer to as the HPO network. And the HPO network is healthcare provider HPO stands for. And if you look all the way over to the references, and that is where, if you were going to do the biospecimen collection, we're going to actually go and do it at a location, that is where you would go. Like I said before, if you want to do this from the comfort of your own home, you can. If you want to do, for instance, the biospecimen and you just want to do the at-home saliva kit, you can do that as well. So you don't have to go there, but that is an option. If you wanted to go to a location, that is where the location is in your area. So that's why I put this particular very, very busy slide up there. If you want to enroll, what do? You go to the joinallofus.org website, and that's all it is. It's joinallofus.org. And this particular slide shows a screenshot of what you would see if you went to the website, and you would click the Join Now button, and it would help you set up an account and take you through the enrollment process. So that's where you can do it. If you want and you have a smartphone, you can also go to your specific app store and you can download the All of Us app and you can join that way as well. So you can utilize that. That's the way I generally interact with the program, as I use their app to complete the surveys and all that kind of stuff. So if you're more inclined to do that, I would encourage you to go ahead and check that out as well. If you just want to learn more, how do you do that? You can do that by going to the website, like I said, joinallofus.org, or you can follow the All of Us Research Program on the 4 big social media channels. They're on Facebook, YouTube, Instagram, and Twitter, generally at the handle @AllOfUsResearch. And you can also follow their hashtag #JoinAllOfUs. And when we've done outreach, we've also used the hashtag #AllOfUsInclusion. So those are ways that you can find out more about the program. But right now, I want to go ahead and open it up and see if we have any questions.
Thank you so much, Carl. So, as you said, let's open up for everybody to get an opportunity to ask questions. So who would like to start?
I have a question, Carl. I know that you touched base on this a little bit earlier, but which demographic does the program currently lack information on?
Question. They are, like I said, they are doing a lot of outreach to folks who are underrepresented in the biomedical research field. So a lot of racial and ethnic minorities, people with disabilities, sexual and gender minorities. The way I like to phrase it lots of times is, so often a lot of our health advancements over the years have been based on research studies that were done of 50-year-old white men, and we don't need another research study that's made up of that kind of a group. If anything, the NIH has made the commitment to oversample people who are part of these underrepresented groups, like people with disabilities. Now, I will say this: that so far, the percentage of folks that are in the underrepresented groups is actually very high. I think it's something like, the last time I saw a number, I want to say it was over half of the folks that were enrolled in this program were part of underrepresented groups, which is very encouraging to see those kind of numbers. In terms of which ones are underrepresented, right now the program's doing quite well. The one thing I always like to point out, though, when we're talking about the disability question is they have a generic disability identifier question right now, but we are working with the program to do a disability survey that would go out to members of the program, and they would be able to answer questions about disability. Right now, we don't know those questions. We know generically how many people with disabilities might be enrolled in the program, and I don't know that number off the top of my head, but we might know that generically, but we don't know that specifically in terms of specific types of disabilities. So for instance, we all know that disability affects everyone individually in very different ways. And you can have, for instance, a common example I like to use is someone with cerebral palsy. That's going to manifest itself in different ways with different individuals. So just because they've got that diagnosis, it really doesn't tell us about any issues they have with functionality. For some people, it affects speech. For some people, it affects mobility. And we really need to ask more specific questions about functional limitations that people experience because of their disability, and we're working with the program to do that. So until we really do that, I can't answer the question about where we really need higher participation as it relates to the disability community.
Got it. Thank you.
Carl, I had a question. Is there a number that the deaf community could call for more information about the program?
Yes, there is. I do not have that off the top of my head, but I can provide that to you guys, and you can send that out.
Okay. And I know you said the age group is from children to adults, right?
Our organization works with all age groups. The All of Us research program currently is only open to adults. They're working on protocols to allow for children to enroll, but right now the All of Us research program is only for those who are 18 or older. I would also point out another thing we're working with the program on that it still disappoints me that this hasn't been addressed yet. They are not in a position to do proxy consents yet. So people with intellectual disabilities who have to have a legal guardian go through a consent process for them would not be able to enroll currently. We are working with the program to develop those protocols so that we can involve those people, because so often when we say people with disabilities who are underrepresented, it's people with intellectual disabilities especially. So we want to make sure that is that's something that's taken care of and addressed so that we can include people with intellectual disabilities as well.
Okay.
And then
Thank
also, how does one sign up to participate?
Yeah, they would go to the joinallofus.org website, which is the website that I mentioned here earlier. I will bring that slide up again. And they would go to this slide, or they would go to this website, joinallofus.org, and they would click the Join Now button, and it would take them through the enrollment process. And specifically, they would initially have to set up an account and with an email address, and then they would ultimately go ahead and they would go through the consent process. where they would have to, give consent to be involved, which involves going through and learning about exactly what the program is, what it does, what it doesn't do, the risks of involvement, which basically is about some of the data issues I was talking about earlier. And it makes them go through that consent process. That consent process can take anywhere from 15 to 30 minutes, depending on how quickly you read and go through that information. But that's what the program does in terms of the consent process. And then that's when, at that point, they are part and participant in the program. And like I said earlier, that can also be done all through the app. So if someone wants to do that on their phone, they can do that on their phone.
Perfect. Thank you.
I know you mentioned about individuals from different ethnicities reluctant to participate in the research. What are some of the fears that you have noticed that they have?
It's usually based on things that have happened in the past. There have been research studies done in the past. For instance, the Tuskegee experiments is probably one of the more notorious examples, where Black men were basically experimented on without their knowledge, and were given diseases and the like to test different treatments on them. And as a result, there is a distrust that the African American community has towards programs like this. So they want to make sure that they are not, that is not the case anymore, that people realize that those kind of things are not going to happen with this kind of a program, that there are protocols in place now that they would not allow them to do that. The disability community has had, things happen in the past where there's been forced sterilization and those kind of things that have happened to the disability community in the past that we want to make sure is not done, obviously. And all of those things are now, there's protections for people in research studies so that stuff can't happen. Excuse me.
So protocols and transparency, basically.
Yes, they're working. There is protocols in place. Matter of fact, there's laws in place now that specifically limit how you're supposed to do biomedical research studies. So that's why you have a consent process that an individual has to go through by law. That's legally required of any biomedical research study, so that they can't just experiment on you without people knowing it. So those kind of things are done, and they require you to have full knowledge and consent of that before you get involved in a study like this.
And usually is the sample a big sample that you'll require, or how big is the sample that you'll
Are you talking about the biosample?
Yes.
The biosample, like I said, can be done one of three ways. You can do at one of the labs, you can do a blood or urine sample. They will, if you do that, they will probably ask for both. But for instance, when I went, they had a hard time getting my blood. So they were not able to use my blood sample. But you can also do an at-home kit for saliva as well. So there are multiple ways you can do that. It's not like going to get blood done for a test that you would have where they're taking vials and vials of it. They just take a little bit that they need to be able to do the DNA and do the genome sequencing.
Thank you.
Any other questions?
Anybody else wants to ask a question? So thank you so much. It was really very interesting and helpful. I know we all enjoyed listening to this research, which will be really valuable. But we definitely will be in contact with you, and we have your contact information, and now we know how to sign up for it if anybody is interested.
Absolutely. And like I said, I'll try and get that number that would allow someone that is deaf, what the specific number is for that.
So again, thank you so much for your time and for the presentation.
Thank you.
Thank you, Carl.
Thank you, everybody.
Bye. Thank you.
Bye-bye.